Good afternoon and welcome everyone. My name is Garima Mathur. I am a dietitian and certified diabetes educator. And we are here to talk about real talk about diabetes, everything that you want to know. So welcome again. November is Diabetes Awareness Month, and Unidos for Diabetes, as you can see right here, was created to bring awareness and support around this issue. And I'd like to take this opportunity to first thank all the agencies who have come together to educate and support all individuals with diabetes in the borderland, promoting diabetes prevention and efficacy. So really, thank you so much. Thank you, Children's Hospital, BMU, Project Vida, Sun City Dietitian, La Fe, and special thanks to Paso del Norte Health Foundation for their continued support. And today with me, I have Patricia Garcia. And so, Patricia, please introduce yourself and tell us about yourself a little bit.
Yes, thank you for having me. My name is Patricia Garcia. I'm the Digital Content Manager at KTSM 9 News. But the reason I'm here is because I'm from El Paso, born and raised, but I, about 7 years ago, was diagnosed with diabetes, so I am diabetic. And so that's what we're here to talk about.
All right, very good, and thank you so much for being here. So during our conversation, if you have any questions, please feel free to put them on the comments, and we will take those questions as they come. So Patricia, one of the things that I'd like to start out with, I heard you mention that you're a diabetic. And as diabetes educators, and as part of creating awareness, is that we want to change the language around that word, I'm a diabetic. And the reason being, so when you think about, or when you say that I'm a diabetic, how does that make you feel?
It makes me feel like people might look down on me for it, or blame me for being in the situation.
Right, and that's exactly right. So when we say that I'm a diabetic, what happens is we feel like it's our fault, or that I'm doomed. We feel helpless, right?
Yeah.
And so what if you were to say that I have diabetes? Try that on and see what that feels like.
I have diabetes.
And so how does that feel for you?
It feels much more empowering, much less shameful.
Right, and it's when you say I have diabetes, which is a disease you have, remember it's not your whole identity, and that allows you to then take action and move forward. Right?
Yeah, no, well, absolutely. One of the things I like to ask about is, the culture factor. How important is that when you're treating people with diabetes to consider, right? I mean, there's a lot of factors, but is culture one, especially here in El Paso?
So I just want to touch back on something that you said. When you say that I'm a diabetic, what also comes up is the shame factor. Now, the reason a lot of people with diabetes feel shame is because they blame themselves. They think that they brought on their own diabetes. And no one can really bring their own diabetes. There are a lot of different factors that contribute to a person developing type 2 diabetes. So here we're talking about type 2 diabetes mainly. Okay? So the different risk factors for developing type 2 diabetes, and it has been covered in other sessions that we have had, is your family history, if you're overweight or obese, if you had gestational diabetes when you were pregnant, or you had a baby that was 9 pounds or more, and it's having an inactive lifestyle, not being physically active, and also your race and ethnicity, being Hispanic, African American, American Indian, Asian, Pacific Islanders. All of those risk factors contribute to a person developing type 2 diabetes. So I'm going to take a moment right here to share with all of you that, in June, I was diagnosed with prediabetes. Now, like many of you who when first got diagnosed with diabetes probably felt surprised or shocked for getting it, and I certainly was, because here I am, been a dietitian for 30 years, and I've been practicing as a certified diabetes educator for about 25 years. And so I eat healthy, I've always eaten healthy, I'm physically active, and so for me to get the diagnosis, it was a shock. And then now, if I didn't know any better, I would have said, oh my gosh, I have pre-diabetes, that means, wow, I can't eat anything anymore. I would have probably stopped eating everything and probably increased my physical activity even more. But as I just mentioned earlier, there are many risk factors that contribute to a person developing type 2 diabetes. Of the 5, I have 2 of them, which is my family history and my ethnicity. Okay. So, it is not entirely true that a person can cause their own diabetes. No one is responsible for their genetics or heredity or their ethnicity. Mm-hmm. So I just wanted to put that out there and to really tell everyone who's watching that you are not responsible for having gotten diagnosed with type 2 diabetes. Mm-hmm. You did not cause it.
Well, that's always good to hear, because you blame yourself, and that might mean that maybe you will delay treatment. So can you tell me a little bit about the shame factor there and how that might affect, getting treated, finding help to manage this disease?
Right. So when you blame yourself and you think you caused it, then of course you go into, like anyone else, we feel, first of all, we deny it. We go through the denial factor. And because that's just a way of us coping, through any bad news. Mm-hmm. And that sometimes helps to take out some of that charge at the beginning, but if that becomes your only way of coping, then it can lead to some bigger problems, because then you're ignoring, you're not going to the doctor for the follow-up treatments, and then you go on to doing a lot of other non-traditional, modes of therapy to bring your blood sugars down, or to say that, to completely deny it that you don't have it. Mm-hmm. So that can actually prevent a person from seeking treatment and actually doing something about it.
Well, what does delaying treatment do? How does that affect a person?
So if you delay the treatment, so here's the other thing that's so very important to understand is how your body works. A lot of times we associate the food that we're eating as the sole cause of our diabetes, and it is not. The food alone is not going to cause it. Just like I mentioned, there has to be all these other risk factors that would contribute to a person getting type 2 diabetes. Now, once a person gets diabetes, it's very important to know how the body works. Now, what is it? Why is it that a person actually develops diabetes in the first place? And the reason for that is that, when we eat food, the food we eat, most of the food we eat converts into sugar in our small intestine. And once the food converts into sugar, that sugar then travels into our blood. And when it gets into our blood, remember, sugar is what gives us energy, right? So that we can continue to walk or think or do whatever it is that we do in a daily routine. And so we need sugar for energy, but the way that sugar gets into our cells, it requires insulin. Mm-hmm. And insulin is what's produced in our pancreas, which is, look at it, just right behind our stomach. Now, if you have developed type 2 diabetes, then you don't have enough. Your pancreas is not producing enough insulin. So if you're not producing enough insulin, then your body's not going to work as efficiently to carry that sugar into your cells. So then what happens to all that extra sugar? It stays in your blood. And that's what shows up when you check your blood sugars. Mm-hmm. Right? Now, the delay what would the delay do? If he decided, okay, no, I don't have diabetes and I'm going to beat it and I'm going to cure it, and you don't go to the doctor or get on medications initially. There was a study done in 1990s, and it was called United Kingdom Prospective Diabetes Study.
Mm-hmm.
And what it showed that a person, all of us actually, if you have diabetes or you don't have diabetes, we all start out with making 100% insulin, our pancreas. And over time, because of the risk factors that I've mentioned, the amount of insulin the pancreas is producing starts to go down. And when it gets to that 50% level,
Mm-hmm.
that's when a person gets diagnosed with type 2 diabetes. So your pancreas is making half the amount, right? Now, a lot of people may not even get diagnosed at that point because the type 2 diabetes, people don't have symptoms.
Mm-hmm.
So if you don't have symptoms, you don't go and get it checked and say you don't know you have it. So what that might mean that your pancreas may be at 40% when you finally get diagnosed. And that decline in insulin doesn't stop there. That decline of insulin continues to happen over time until your pancreas is making no more. So as you can see, if there's a delay, what is the natural progression? Is that there's going to be a decline in the amount of insulin the pancreas is making. And then by the time you go to the doctor, now it's going to be harder to manage just with eating healthy and being physically active, right? Because that is the first thing that your doctor will tell you to do is, get diagnosed, eat healthy, lose some weight, and be physically active. Now, there have been studies done, and it is important to do those things, and there have been studies done that show that anyone who has prediabetes, you can actually delay from getting type 2 diabetes. So in this study, the people lost about 5 to 7% of their body weight.
Mm-hmm.
So if you're 200 pounds, that would equal to about 10 to 14 pounds. And these group of people, by losing about 10 to 14% of their body weight, they actually decreased their risk for developing type 2 diabetes by 60%. So you can definitely delay it, but can you prevent it? No. Because of your ethnicity, your family history, those risk factors you can't change. So, but definitely you can delay it, which is again, is very positive. So getting diagnosed early, getting into the doctor sooner, you can actually make some of those positive changes and can delay.
Okay, got it. Well, and talking about insulin, I think that people might be afraid, and that might be another reason why they're delaying treatment. Can you tell me a little bit about, using insulin and I guess the fear factor that might be associated with it?
Yes, there is a lot of fear factor, and when we do our classes, one of the things that we always ask our clients here about insulin and how they feel, and we definitely hear a lot of negatives about it. And one of the things that we hear, which is very, very common, is that insulin is associated with all kinds of complications. People think, if I never want to get on it, and they don't it's not just the needle, it's also the fear that if they get on insulin, that means now that's going to cause them to go to dialysis, or now they're going to have amputations, or that they lose their eyesight. And if you remember when I was talking about that diabetes is what we call a progressive disease, in that the amount of insulin your pancreas is producing continues to decline over time. So if you are no longer producing any insulin, what's going to happen to that sugar? Where is it going to be?
It's just going to be
going to stay in your blood, right? It cannot get into your cells. That's how we use, sugar for energy. But if the sugar cannot get into your cells, that's what causes a person to be tired all the time, feeling lethargic, sleepy, hungry all the time, along with feeling, going to the bathroom a lot, right? Yeah. And so, no insulin, that sugar that's sitting in your blood, is then getting into your little tiny blood vessels around your eyes, your feet, around your kidneys, around your heart, around your brain. And then it starts clogging, makes the blood very thick. So the nutrients can't get through all of these different organs. And then when they don't get those nutrients, then they start to get damaged because they go dead because they're not getting the nutrients that they need to stay alive, all these organs. And that's what causes complications. So actually delaying getting on insulin is the cause of developing a lot of the different complications associated with diabetes. Now there are a lot of new medications that have been developed in those last 10 years, and they're really amazing medications. So, your doctors will try to get you on a lot of the new medications to help you manage it, but then, those medications spoke up to a point, to a point when your pancreas is producing insulin. Once there's no insulin, then yes, you will need to inject insulin. And the only way right now is through injection, although there is an insulin that is an inhaled insulin, you can inhale it. So you don't need to inject.
Interesting.
Yes. Yes.
I'll sign up for that. Well, can you tell me a little bit about, you mentioned, this is something you have to manage. So there's no cure. There's no, can you tell me a little bit about, myths associated with that?
Yeah. So yes, number one, there is no cure for diabetes. You have it, you will have it for life. Yes, you will have to manage it. You can manage it, and we don't even like to use the word control, because I heard in one of the conferences that I had gone to where this presenter was, had this type of diabetes, and her blood sugars would fluctuate, and she couldn't really manage them in the range of 80 to 140. Somebody kind of said, well, you should, why is it that you can't control your blood sugars? And so her response to that, and that would be my response for everyone who, if somebody asks you, well, how can you not control your blood sugars, is if you have kids or if you have grandkids, are you able to control your kids all the time, 100% of the time? No, that's an impossible task, right? The same way, blood sugars you can't control. You can manage them, but you cannot control your blood sugars. So, and we don't even ask for that. We don't say that your blood sugars have to be in that range of 80 to 140, 100% of the time, because that's also an impossible task. What we ask is if your blood sugars are within that range 75% of the time, you're doing great. And having those blood sugars in that range for 75% will definitely prevent you from having a lot of complications associated with type 2.
Excellent. That's actually something I never knew was.
Yeah, and so to come back to your question about, of course there is no cure. And so what about some of the remedies, right? So these are really myths, but they can act, sometimes, we need something that gives us hope. Okay? We need something that makes us feel, like we don't have diabetes. Believing in something. So I am not here to take that away from anyone.
Sure.
Because if that gives you hope and it makes you believe in something, please do. Please continue doing it. But know that you cannot replace from taking your medications or eating healthy or being physically active, managing your stress. All of those things you will still have to do.
Yeah.
Because again, the number one thing that's happening in your body is that your pancreas is no longer producing enough insulin. So if it's not producing enough insulin, all those remedies, they're not going to start producing insulin.
Mm-hmm.
Yeah. So just be careful of what you take. And the other thing is you always want to make sure you let your doctors know what you are taking. Because there are a lot of contraindications for things. And so they may work against the medications you are taking. So you always want to let your doctors know what you are taking.
Excellent. No, that sounds good to keep in mind. Because definitely sometimes I want to try some sort of vitamin or whatever, and I always have to think like, oh, wait a second, maybe I should think before I try it. So
and taking vitamins or like cinnamon or turmeric, which have become very popular, and those are all different spices and herbs, and those are perfectly okay as long as they're part of your your meals or your routine. There's no harm in taking that.
Yeah.
I am talking about some very traditional remedies that are out there, that somebody may put something together and say, okay, take this and this will cure your diabetes. Well, there isn't.
Yeah. Well, you mentioned hope, and so I was very happy to hear you were talking about that. One of the things that I was sort of disheartened by when I learned I had diabetes was that I kind of felt like I have to give up everything. As a Latina, I eat a lot of stuff that might be considered kind of no-nos on the list. So, how does somebody like me manage my diabetes and still, eat within the things that I know?
So, again, what's important to know here is there is no diet for people with diabetes. Number one, we do not believe in any diets, and there are no diets. You can eat just about everything you want. Okay? It's not what you eat, it is how much you eat. So it's about the quantity and the quality of food. So when we talk about quality of food, we're talking about whole grain products that are healthier. So this is for anybody. It doesn't matter if you have diabetes or not. This is part of, having a healthy lifestyle. Right? So it's really all in the portions. So you can still enjoy some of your favorite foods and being, Latina and foods that you grew up with, tortillas and beans and rice. Yes, but what's important here are the amounts and the portions, and that's one of the things that we do. We spend a lot of time in our classes. We talk about portions. Whole classes on nutrition. Really making people aware of the amounts, because what we have found is that when people start cutting back on the amount of food they eat, that sometimes automatically takes care of their blood sugar. So they don't have to give up. You just have to cut down. Right? Patients' cultural background, and then the foods that they grew up with, because we want to make sure that that is part of their meal plan that we create for them. Because if I were to give you a plan that didn't have any of your foods that you were used to, eating or grew up with, are you going to follow it?
Absolutely not.
Right? So it defeats the purpose.
Right.
What we're trying to do is we're trying to help individuals, move towards a healthier lifestyle. And that's where our focus is. And it is not about bringing shame to what you eat or how much you eat. It is really creating awareness so that you can see with the amount of food you're eating, how does that impact your blood sugars, and when you cut back on the amount, what does it do? So that's what we really focus on.
So when you are trying to, say you just got diagnosed, you're trying to figure out kind of how to manage this, of course you go to your doctor. What other people should you have on your team to help you figure all this out?
So it's definitely having an interdisciplinary team, where you have a physician, you have a certified diabetes educator, and who is also a dietitian, but it's not necessarily that the certified diabetes educator has to be a dietitian. You definitely want those two people on your team, because diabetes educators have that inside knowledge on how the body works, what are the things that affect the blood sugars, and working closely with physicians can be an asset, because that actually helps to, what I call it, up level a physician's practice, because physicians don't always have the time to really do all that education. And the classes that we offer here, our program, we offer about 10 hours of education that an individual gets. And think about, when you go to the doctor, how much time the doctor has? 15, 20 minutes.
Right.
At the most, half an hour.
Yeah.
Right?
Yeah.
And we spend 10 hours in the education. Now, we work very closely with a lot of the physicians here in town. And one of the things that we do is, if we notice something that, a person's medication is not working, or that their blood sugars are very high, and they're eating healthy and being physically active, but the blood sugars are high, that they may need medication, or they may need to start on insulin, we can then communicate that with the physician. So then the physician is aware of it, so when the patient goes back to see the physician, they're able to make those changes. Now, a lot of times what happens is, we also see a lot of patients, they go to the physician, their blood sugars are high, and when the blood sugars are high, the only way that physicians can is help lower blood sugars is by either increasing their dose or starting them on medication or insulin. And lately, what I have been seeing in our classes is a lot of people are not consistent with their medications or insulin injection. So the blood sugars are high. It's not because, that the dose that they're taking, it's that they are not taking it.
Yeah.
So they're not getting that benefit. It's because they don't understand how the body works. So we spend a lot of time doing all of that. So having that support and having that team can really make a big difference. And so just on that, again, I'm a dietitian, and I will tell you, before I became a certified diabetes educator, I did not have that knowledge of how the body works and how all the different pieces come together in managing blood sugars. So if somebody would have come to me when I was just a dietitian, I would have just given them a plan. Okay, you eat this, or you don't eat this, or no, you're eating too much. Then the focus again would have been all on the food. Now, as a diabetes educator, I have the knowledge of food, but I also have the knowledge of how the body works and the different medications, for managing the blood sugars. So I can put it all together for an individual. So you do want to make sure that whoever you're going has that background, has that knowledge, because it can, I understand knowledge. I mean, any type of education is better than none, but I'm afraid what happens sometimes is that incomplete educational knowledge can put a person behind, because then again that can perpetuate that feeling of blame and guilt then every time they eat, because it's not part of their plan. So it can be a setback for a person with diabetes.
Okay, got it. Well, you did mention earlier kind of the feelings of like sluggishness. What are some not warning signs, but signs that you might have diabetes? Because when I got diagnosed, it was just that my doctor decided to do these tests. I didn't even think I had diabetes. But before that, I noticed I was constantly thirsty and had to go to the bathroom all the time. I just could not figure out what was happening.
And so those are the classic symptoms. Okay? Increased thirst, frequent urination. And a lot of times people don't go to the doctor because, we live here in El Paso, right? So it is hot in the summer months. And so if you're drinking a lot of water, well, what are we thinking? Because it's hot,
Right.
And you go to the bathroom, Well, that's a connection between because I'm drinking a lot of water, so I'm going to the bathroom a lot. So there's nothing unusual about that. So that is one of the reasons, as I mentioned, people don't have symptoms and they can go for many, many years. A person can go up to 10 to 12 years before even knowing that they have diabetes. And it's because of that. Right? And so some of the other symptoms of type 2 diabetes, those are classic, includes thirst, frequent urination, feeling tired all the time. Remember, if your cells are not getting the sugar for energy, they are going to feel tired. Right? So that's part of one of the symptoms of diabetes. And then the other is hunger, because again, your cells are hungry, so they want more food, and then you keep eating. What takes a lot of individuals to see the doctor and get the blood work done is when they start having blurry vision. That's the time, or when they start having tingling, or there's a wound in their feet that's not healing, right? So those, by the time you have those, you've had diabetes for long and the damage is already starting to happen. So we want you to, again, as part of the Diabetes Awareness Month, it's very important. If you have a family history and you have, you fall into the category of one of the ethnic groups, get tested. Okay? It's nothing to be afraid of. There is a lot of support here. All the different agencies that I have mentioned, a lot of different agencies, we all offer different education programs. So again, get tested, get educated, because education is the key. Education is the key. That is what's going to help you. It can make a difference from you living with the disease and healthily and not having any complications versus having complications. Education is the key, and getting tested early enough to start the treatment.
Okay. Well, I've definitely heard about some of the complications. Eyesight trouble, amputations. What are some of the complications that you can face? Maybe that might not be as dramatic, but that are still concerning.
So the big ones, like you said, it's losing sensations in your feet, tingling sensations, or numbness, burning sensations in your feet, your kidneys. Of course, we don't feel that our kidneys, with the feet you can feel, right? Because we have those symptoms. But with our kidneys, the damage is happening internally. And kidney is our organ that filters all the waste products. So because of this damage into those tiny blood vessels that help with the filtering of filtration, they get damaged. And so that's happening internally. You may not notice about it or know about it. And by the time a person, sometimes, again, if you don't go to the doctor and you don't understand what those different numbers mean and how can you tell if your kidneys are functioning well or not, a person, by the time they find out that their kidneys are not functioning, is when they're ready on the cusp of going to dialysis. And we have seen many patients here that they have come to our classes just when they are getting ready to go on dialysis. And it is very disheartening. It's what can I say? It's very painful for us to watch. Okay? And as they go through the classes, they're like, oh, I wish I knew about these classes. I wish I could have come earlier so I could have prevented that. Right? So it's very important if you have diabetes, please ask your physicians to refer you to the diabetes management program, because it can make a difference. And of course, with your eyesight, you will feel it right away in your blurry visions. But remember, by the time you get to that blurriness, their damage is already happened. Now, I don't want it to make it all gloom and doom kind of thing, that everything gets lost completely. It is not. Right? It is not. So, if you can manage your blood sugars, understand how your body works, come to the classes, and if you can do that, some of those, the damage that has already happened can be reversed.
Okay.
right? It can be reversed, but when you're at the cusp of getting onto dialysis, that cannot be reversed, right? But if you are at, let's say, 50% or 60% of kidney damage, with managing your blood sugars, you can reverse it. You can reverse it. You can reverse the damage that's happening in your eyes. It can be done, but when you come to a point when you have, you really can't see well, or you're getting those little injections in your eye, then it's kind of late at that point, right? So, again, there are other organs that are being affected, but those are the main, your heart. That's why people with diabetes are at very high risk for heart disease and stroke. And because with diabetes goes along high blood pressure.
Sure, yeah.
Right? So with that, it's all of those kind of go hand in hand, all those health issues.
Yeah, that was always very surprising to me because, when you think of diabetes, you think blood sugar solely. You don't think of how it affects the rest of your body, but,
Right.
it all works together, so that makes sense.
Yes.
Can you tell me a little bit about the class and the management program? Because I was always surprised to hear about the resources out there that can help you really manage this disease.
So I can speak for our program, which is a very comprehensive diabetes management program. Like I said, we offer 10 hours of education, and the classes are conducted by me. I'm a dietitian, certified diabetes educator, and we have another dietitian. So classes are once a week for 4 weeks, about 2.5 hours long. It's a very individualized program in that we help you do a lot of problem solving. So it is not just about coming to the class and sitting through a PowerPoint. No, these classes are very engaging. We do a lot of different activities here to help you to understand a lot of the different concepts, because these concepts are, these are very hard concepts to remember. So again, once a week for 4 weeks, it's a 6-week program really that you go through. You get a one-on-one at the beginning, 4 classes, which are group classes, and then we have another one-on-one where you get your individualized meal plan. Now, during the times of COVID, yes, we are open. We are still conducting our classes here. We practice social distancing. Everyone wears a mask. So, as you know, with COVID, people who have diabetes and high blood pressure, heart disease, are very high risk of, for mortality. And people with diabetes, their complications with COVID are severe, much more than someone who does not have diabetes.
Sure.
So this is even more important for you to learn how to manage it, because what happens when your blood sugars are low, it's really your immune system is down. Okay? When you have a lot of sugar, remember, the nutrients can get to your cells, and even if you're on medications, they don't work. So if you get sick, first of all, because of the high blood sugars, you are more prone to get infection. You're more prone to get a flu. You're more prone to get, sick. And once you are sick, then because of COVID, it brings on the additional respiratory issues and trouble breathing and all of that, and could lead to pneumonia or all of those things. So that complicates your chances of recovering. And so the severity of the complications are higher because of diabetes.
Okay, that makes sense. Can you tell me a little bit about how you sign up? Do you have to sign up through your doctor, or do you call the office here?
So it can be done both ways. You can call us at our office, and our phone number is 532-6280. Or, you can call and get into our program, or you can go through your doctors. Okay? They can send us a referral, and then we can contact you. But we would always contact you first, and we'll explain to you about the programs, and then once you come for our initial visit, that's when we assign you to our group classes. It's based on the availability. Okay? Yeah. Anybody has any questions? Anyone has thank you everyone for watching. Thank you so much, Patricia, for being here, for helping our viewers really get a better understanding of, what to do when they have diabetes. So we really appreciate you being here, and thank you, everyone.